Big news in our health lead. The Health and Human Services Department Secretary, RFK Jr., has long been on a quest to find a villain on whom to blame increasing autism diagnoses in the United States. And this has led to a shocking pending announcement. HHS is expected to link Tylenol use during pregnancy to the developmental disorder. It's a move first reported by the Wall Street Journal earlier today. This despite the fact that the FDA and obstetrician gynecologists across the country continue to assure millions of pregnant women that Tylenol is safe to use, although, as with all medications, over the counter included, all pregnant women should consult their doctor before taking any medicine. What's even more curious about this pending announcement, though, is that for years, RFK Jr. has been peddling the long debunked theory that autism is actually caused by childhood vaccines. And RFK Jr. says he believes that. He can believe it all he wants, but he's wrong, according to credible medical and scientific experts. Now, of course, RFK Jr., according to our new reporting, has a new villain. It's Tylenol. Kenvue, the maker of Tylenol, said today in response, quote, "We have continuously evaluated the science and continue to believe there is no causal link between acetaminophen use during pregnancy and autism," unquote. The HHS responded this afternoon saying, quote, "Until we release the final report, any claims about its contents are nothing more than speculation," unquote. Joining us now, CNN senior medical correspondent Dr. Sanjay Gupta. Sanjay, is there any credible data, any credible evidence suggesting that there is a causal link between Tylenol use by pregnant women and autism?
Not a causal link, no. But at the same time, this whole theory is not coming totally out of the blue either. There's been about a decade's worth of studies that have sort of looked at this, Jake. People have raised the specter and the possibility of acetaminophen or Tylenol, it's the same thing, potentially being associated with autism. There were studies, I think about 10 years ago, that did not really show this link. And by the way, hard studies to do. You're basically saying a child who has autism, asking that woman to go back, look at pregnancy. Did you take Tylenol? How much Tylenol did you take? When did you take it? It's hard to remember. I mean, that's the nature of those sorts of studies. But in 2019, we reported on a study out of Hopkins where they looked at cord blood. They looked at blood in the umbilical cord, measuring acetaminophen levels, and they did find in that pretty small study that higher levels of acetaminophen was associated with higher rates of autism. But again, it was an association, not a causal link. I think what has attracted a lot of attention is a study just from last month, Jake, August of this year, basically looking at 46 studies, and 27 of them did find an association between acetaminophen use, Tylenol use, and autism. But again, I will tell you, these are hard studies to do. And also, when you have something that's as ubiquitous as Tylenol, there are so many other factors that could come into play. Like, why were they taking Tylenol? Did they have a fever? Could the fever be the culprit? You sort of get the idea. And just to give you some statistics, I think 45 to 60% roughly of women during pregnancy have used Tylenol. So it's widely used across the board and widely used within this population as well. Quickly, I'll just tell you, ACOG, which is the American College of Obstetrics and Gynecology, they did release a statement about this. And they have long advised that if you use Tylenol during pregnancy to reduce fever, it is better than having a fever, which can be detrimental. But they said acetaminophen has long been established as a safe pain reliever for pregnant individuals during pregnancy. There's no clear evidence that proves a direct relationship between the prudent use of acetaminophen during pregnancy and fetal developmental issues. Neurodevelopmental disorders in particular are multifactorial and difficult to associate with any singular cause. So they've all, if you go to your doctor, they would say, if you have a fever, take Tylenol, but take the lowest amount for the smallest amount of time to use it in the most prudent way, Jake.
Yeah, I mean, I find it so confounding because, women who are pregnant have pain and they take pain reliever quite often. 2024, pregnant women are told Tylenol is a way safer pain reliever than Advil or ibuprofen during pregnancy. And you say 45 to 60% of pregnant women have used Tylenol. I don't want to be flip about this, but I mean, they also drank water while they were taking the Tylenol. I mean, it's so omnipresent in terms of how many pregnant women take this. I mean, if Tylenol caused autism, there would be so many more autistic kids right now than there are. So what would you tell a pregnant woman right now who has pain?
I think the guidance that has been out there for a long time, because again, we're not talking about something that's new. People have been talking about this issue for a long time. I'm not sure why it's getting this new enthusiasm, probably because RFK Jr. is talking about it. But yeah, a fever is a bad thing to have as a pregnant woman. You need to control that fever, take the smallest dose for the shortest amount of time. That's been the guidance. Also, I will say that part of this new reporting as well is he's suggesting that a B vitamin known as folic acid or folinic acid specifically might be a treatment for autism. As you know, Jake, you have kids. Jen probably was told to take folic acid when she was pregnant. So my point being that these have been recommendations that have been out there for some time. But your point about it being omnipresent, that's a really important point. There's this thing called the paradox of ubiquity. When you have something that's that common, it's very hard to start pinning it down to causing a specific problem like a neurodevelopmental disorder. As one of the researchers said who wrote the study, do not draw a cause and effect relationship from this study. They specifically said that. It would be like saying in the summertime, people eat more ice cream,
right,
and there's more violent crime. Those two things have nothing to do with each other, but people may associate them together because they both happen in the summertime.
I'm guessing more than 60% of pregnant women have pizza. And yet, that's not an association, right. But again, I'm not trying to be flip about it, but it's everywhere, Tylenol. Dr. Sanjay Gupta, thanks so much. Let's talk now with an OBGYN, Dr. Veronica Gillespie-Bell, also a vice chair of the American College of Obstetricians and Gynecologists Clinical Practice Guidelines Committee. Dr. Gillespie-Bell, you're a practicing OBGYN. What do you plan to tell your patients about the use of Tylenol during pregnancy?
So I will maintain the guidance that comes from ACOG, the American College of Obstetricians and Gynecologists, that Tylenol is safe. We have no studies that show Tylenol causes autism.
A 2024 study published in the Journal of the American Medical Association looked at more than 2 million children born in Sweden between 1995 and 2019 and found no increased risk of autism in pregnant women who use Tylenol. But there's this also recent meta-analysis in the journal BMC Environmental Health that concluded there was strong evidence of an association. What does that mean? And what is your advice to people who see these two different reports and don't know what to make of it?
Well, just as Dr. Gupta said, an association is not causative. And I think it's important for pregnant women to understand that. And as was also mentioned, when we think about the reasons women take Tylenol, usually it's for pain. There is no safe alternative in terms of medication, or they're taking Tylenol for fever. Again, there's no safe alternative, and a fever is detrimental to a pregnancy. And so for my patients, for other patients, I would just maintain that our guidance tells us that Tylenol is safe in pregnancy.
What do you make of the HHS's additional recommendation, we're told is going to be in this report, recommending that pregnant women use folic acid, which is a vitamin found in prenatals, specifically to treat autism or prevent autism? What do you make of that?
It's been long recommended to take folic acid to prevent neural tube defects. And so I do think that the ACOG will still be making that recommendation. There is no data that shows that it's curative for autism, but we do recommend folic acid for the prevention of neural tube defects.
So what do you make of this whole thing? Because obviously RFK Jr. Has been out there saying for more than 2 decades, falsely, that childhood vaccines are responsible for the increase in autism diagnosis. First, it was about thimerosal, which was a preservative used in some of the MMR vaccines, although it's not there anymore. And then he just has been disparaging childhood vaccines. So has President Trump, for that matter, with anecdotes that prove nothing about a kid who seems normal and then gets vaccines, and then all of a sudden the kid has autism. You must be asked about this all the time as an OBGYN. What do you tell expecting mothers?
So I give patients the risks, the benefits, the alternatives. I let them know that there is no data that shows that vaccines cause autism. Of course, it is always going to be up to the discretion of that parent for how they choose to vaccinate their child. But I do let them know there's no data that shows vaccines cause autism. And we know that vaccines prevent diseases that can be fatal to children. And so I give them those risks and benefits and try to guide them to the best decision for them and their family.
Dr. Veronica Gillespie Bell, thank you so much. Appreciate your time.